A growing crisis is gripping our nation. Millions of Americans are living in severe pain and turning to prescription painkillers for help. The CDC reports that 20% of U.S. adults experience chronic pain.
And of those people with chronic pain, up to 30% misuse opioids. That means millions are living with a vicious cycle of pain and addiction. And as Wink News health and medical reporter Amy Osher explains, an implant may help relieve their pain without drugs.
My addiction started with alcohol when I was 23.
Malia Baird's addiction continued for 2 decades.
I was actually on my way to an alcohol class that was mandated, and I decided that I would stop at the liquor store and get ready for that meeting.
She never made it. Malia blacked out behind the wheel.
By the time I woke up, I had had 4 or 5 major surgeries.
Basically, everything below her waist was broken, the pain overwhelming, and she was addicted to narcotics. Neurosurgeon Giancarlo Barolet at Presbyterian St. Luke's Medical Center in Denver introduced a neurostimulator to relieve Malia's pain. He placed electrodes between Malia's spinal cord and vertebrae. A battery pack was placed under the skin near her buttocks. This device stops the majority of pain signals.
We're able to either interrupt or change that signal so that when it reaches the brain, it's not perceived as pain.
The electrodes are controlled by a remote control that patients manage. A study published by the Journal of Pain found that neurostimulation was effective in reducing opioid use by nearly 60%. Malia uses her stimulator every day and is now completely drug and alcohol free. Amy Osher, Wink News.
Now, the doctor says anyone who has had pain that lasts for more than 6 months and has not responded to various treatments is a good candidate for that stimulator. The pacemaker does also contain a lithium battery and needs to be replaced about every 12 years. The procedure to do that is outpatient and it takes about 20 minutes.